Hi, my name is Lisa Dowling. I'm the founder of the Cupping Revolution. Today we're going to talk a little bit about plastic cupping devices. So plastic cupping devices were one of the first really important transitions for the modality of cupping therapy. And why I say this is because previously the main tool that was used for cupping therapy were glass cups with fire. And so obviously glass cups with fire are a much more complicated process to go through. They require a little bit more expertise in making the fire properly happen safely and getting the right amount of suction on the body. So back about 40 years ago, the plastic suction cup and trigger gun were developed, and this made cupping therapy a lot more accessible to a lot more people around the world. So from this point we started to see cupping being used in physiotherapy and chiropractic and massage therapy, and really used as a tool on a lot of athletes. The upside to these plastic cupping vessels is, again, super simple to use. You're just applying the gun to the cup to create your suction. Now there is also a tube that many cupping packages are included, and this tube allows the cup to be away from the pump, and we're going to demonstrate in a couple of minutes how this can be beneficial. It's very good for self-care treatment because we now have access to many parts of our body that we previously may not have been able to reach and achieve suction with cupping. So the tube is a great tool for that. It's also very good if you're doing cupping, holding, and releasing techniques on the body, because you can move the cup, pump the gun, release, and it makes things work really well. Again, we're going to talk about that a little bit later. The downside to these plastic cupping vessels, for me, there are two downsides to these vessels. The first one is that when we are applying the gun and applying the cup to the body and creating suction, we have a very loose gun and trigger action here. So what tends to happen is many practitioners are over pumping the tissue into the cup and creating too much suction. This doesn't happen with glass or silicone cups because the body only gives you a natural amount of tension. And what I mean by that is that when you're applying the glass cup, the negative pressure in the cup is created by the oxygen being removed from the cup, but the natural tension in the skin rising up it's only going to come as far as what is available in the body. And that's exactly the same with the silicone cups, is that when the natural tension in the body is greater than what is in the silicone cup will actually collapse in on itself. So when we're using the plastic cups, we don't get that kind of feedback. We also, with the other cups, we have an instant response from the body about how much suction we are creating. Whereas here we have this loose gun, it doesn't really tell us because this is a very powerful mechanism in the gun. So it allows us to take a lot of suction, sometimes more than what is needed. So what I'm seeing a lot with plastic cupping is practitioners who don't fully understand how deep to apply their cups and why. So we're going to talk about that further in a moment. But first, I want to talk to you about the other problem that has been brought to my attention with the plastic cups. And what this is, doing my research with the World Health Organization in proper cleaning and disinfection of high risk materials, which is what cupping falls into, because there is a real risk of blood and body fluids getting onto the surface of the cups. So we do need to do high-level disinfection on our cups. So in the category of high-level disinfection, it clearly states that the instruments should either be one piece or they should be able to be taken apart. So this is a problem with the plastic cupping vessels because we have this little trigger and magnet inside of the cup. The magnet can come off, but where the magnet attaches inside of the cup, there are several moving parts in there. So this is a little bit of a risk for cleaning and properly disinfecting the cups. Very easy for mold, bacteria, fungus to grow inside of these triggers. So these cups cannot be reused for a long time. They actually need to be recycled, disposed, and many people believe that you can never fully achieve proper disinfection with plastic cups. It's a little bit of a personal call. I believe if you're using these kinds of cups, understand the risk and understand the consequences. For me, I have a set of plastic cups in my home. So I can use these plastic cups on myself for self-care. Also, my close family members, I can use these plastic cups on them, and I know what their health condition is. I've seen their blood work, so I know that we don't really have to worry too much about passing a disease on. Now, having said this about the plastic cupping sets, there is a very easy way to bypass this issue with disinfecting. If you want to use plastic cups on your clients, my recommendation is to have your clients buy their own set of cups. If they buy their own set of cups, you disinfect these cups, you have their name on the box, and then each time you treat them, you're using their cups on their body. Then you don't have to worry the same way about potentially transmitting bacteria, virus, mold, fungus, disease to another client. So this is a very easy workaround for using the plastic cups in your clinic.